Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest to introduce you now. Gabriela Rosa is a world renowned fertility specialist, author, reproductive health educator, and Harvard University awarded scholar. As the founder and director of the Rosa Institute, Gabriela developed a highly effective and unique treatment method that delivers highly reproducible results. Having now treated, educated, and empowered over 140,000 couples in more than 110 countries worldwide. Oh my goodness. Gabriela is passionate about helping her patients uncover the root cause of their reproductive difficulties so they can hold their babies once and for all. Gabriela has completed clinical research programs, including her master's in public health degree at the Harvard University's T.H. Chan School of Public Health, and she is also educated in numerous health disciplines, including naturopathy, nutrition, and botanical herbal medicine. Together with her team, Gabriela delivers the Fertility Breakthrough Program, which has an amazing track record of results. Gabriela's latest book, Fertility Breakthrough, Overcoming Infertility and Recurrent Miscarriage When Other Treatments Have Failed, is available now on all quality booksellers or on Spotify. Gabriela Rosa, what an absolute honor it is to welcome you to Boundless Body Radio.
Thank you so much for having me, Casey. It's wonderful to be here.
It's such an honor to host you. I've been consuming a lot of your content recently, and I told you off air, it feels like I've known you for a very long time. And as I was kind of listening to some of your content and getting to know your work, which I absolutely love, you do such an amazing job. It was kind of different because I see your name and it looks, Portuguese, maybe Brazilian to me, but I don't pick that up in the accent. It almost sounds like maybe English or Australian. And it turns out that you are actually from Brazil, which is amazing.
Yeah, it's kind of like I feel like I have a split personality when it comes to when people ask me, where are you from? And I'm like, okay, let me think about this answer to this question because it almost confuses me. Obviously, I've lived in Australia most of my life, but I was born and raised in Brazil. And, I spent some of my formative years there, and my family still has very strong roots in Brazil. So it feels like, like these days I get asked, where are you from? And I'm like, let me think about that.
My wife was military, and so she would answer that question exactly the same. Like, she's born in Germany, but she's lived everywhere. So where's she from? Like, you're moving all the time and from lots of different places. And you mentioned you also had spent some time in Germany as well. Is that correct?
I did. I was actually an exchange student in Dinslaken, the Northern Rhine, near Düsseldorf and Essen, and it was such a wonderful time in my life. I think that every child or teenager should actually have that kind of experience. I'm a big advocate for moving around, different countries, having different experiences. And I was very lucky, obviously, when my parents decided to move to Australia. I was very young. So, it was kind of like I was about 12, 13. And it was my first experience of not only kind of like going overseas, but going like 30 hours away on a plane kind of thing. But it really had a huge impact on my independence, my ability to just kind of view the world in a completely different way. And yeah, it was amazing. So really highly recommend it.
That's amazing. What a cool experience. I love that. So when I lived 2 years in Brazil, and it was for religious purposes back in the time. It was a 2-year LDS mission that I served. And so after a 2-month stint in Sao Paulo, they took me down to the southern part of Brazil. Santa Catarina is the name of the state.
Yeah.
And we were bussed up into my first city. And I'm looking out the window, and like it was like leaving Brazil and entering Germany. It was
Oh,
crazy. Some
no.
of these
Yeah.
cities in Brazil, it's the second most common language in Brazil is German. And like the
Yeah.
architecture, the food, like people would yell at their dogs in German and talk to us in Portuguese. It was so interesting. Like I thought I landed in the wrong continent or something. It was very
Yeah,
strange.
it's amazing actually because the south of Brazil was colonized, obviously, by Germans, and it really is exactly as you described. Like it's a different country when you go. Everything is organized. People are actually really polite. Whereas the rest of Brazil, it's wild, and very kind of loud and it's fun. Obviously, there's many really wonderful things about Brazil, the food included.
Oh,
But that distinction of like where you go from south to north, like northeast as well, it's literally different countries
yeah.
in all of those different stages. So yeah, it's pretty amazing.
Well said. It's a wonderful country, and I love watching the Seleção play soccer to this day. I love them in the World Cup, and yeah, it's I have very fond memories of Brazil, and so
Even
I
when
love.
they lose to Germany by 7-0,
Oh,
in
too
the World
soon.
Cup. But let's not talk about that.
Too soon. 2014. Too soon. I remember I was flying. I was in an airport, and I looked and saw the score was like 2-0, and I had to go check in, and I saw the score like 10 minutes later. People are openly crying in the stands. It's like
Literally.
5-6-2. I'm like, what is going on?
I remember where I was that World Cup.
Oh,
Let me tell you, it was horrific. It was
was
horrific.
horrific. Yeah, not good. In Brazil, of all places. Yeah, that was a
Oof.
not not a good day. Not a good day. I'm going to edit that part out. We're not talking about that. Your work is fabulous. Like I said, I've really enjoyed digging into what you do. I think it's so important, and I want to hear kind of your story about how you got interested in not only what you do, but how you approach it. But before we do, can you tell us a little bit about the state of the state as far as infertility goes? It
Yeah.
seems fairly obvious that this is a problem that more and more people are experiencing, at least what I'm observing. Um, how is your job security these days? Like, what are you noticing about the issues of infertility in the world we're living
Yeah.
in today?
Yeah. It's a good question. And actually, the way you put that made me think about something completely different. And, yes, infertility is more talked about these days. I also, we know that from statistics and population data, we know that sperm counts have decreased substantially. We know that what was considered a normal sperm count back 50 years ago is actually like heroic sperm these days. And so, there's been lots of changes from that perspective, but I think the world is also changing in many ways, and I think that the risks to population fertility are actually different to what we think. And I also think that there is a societal piece here as well, where people these days are actually, it used to be 50 years ago, maybe 100 years ago, in the time of our grandmothers and great grandmothers, you wouldn't even question whether you'd have children. It was just something that you did. You got to kind of reproductive age, and at 13, you were married, and you probably were already holding your second child. And so, whereas now, people really are actually thinking, will I or will I not have children? Does my life include children? Does it not? And I think that there's a lot to be said about the state of the world. And, I'm sure that if we don't want to talk about the World Cup, we don't want to get to this conversation. But, um, I think that that's one factor and that's one piece. And especially as we look at population data and we look at the trends of fertility rates and the fact that they're declining. Yes, there is an aging population piece, there is an environmental exposure piece, but then there is this kind of societal piece of, people really thinking and rethinking the idea of family, what it looks like, what it means. Does it include children of my own? Does it include being a part of a community? Does it so I think that people have different options these days and consider the whole idea of having children in a different way to what they used to. So if we kind of put that aside and we look at the population data around those people who wish to have children and have difficulty conceiving or keeping a healthy pregnancy to term, yes, there is also somewhat of an increase in terms of that, where, these days 1 in 6 couples experiences difficulty conceiving or keeping a healthy pregnancy to term. There's definitely an increased risk of miscarriages and pregnancy loss, amongst our general population. In fact, it's thought that from a reproductive epidemiology perspective, that 3 out of 4 pregnancies actually end in miscarriage. So
What?
that's quite significant. Yeah. So for every woman that gets pregnant, 3 out of 4 of those pregnancies don't actually yield a live birth. Now, what's interesting about that is that sometimes that is happening even before a woman knows she's pregnant to begin with. And that
God.
happens also in that kind of like 2 week wait. And if you think about it, the way that it's mostly visible in our day to day today are the couples who basically go through fertility treatment, have an embryo transfer, and end up with no positive pregnancy test at the end of that. Because what happens when you have an egg and a sperm together and you have an embryo and that embryo gets transferred into the uterus, at that point, that woman is pregnant. Now, whether that pregnancy continues or not is a different story. But what ends up happening is that, just in general, and this is not talking about people going through reproductive treatments, but in general, there is that estimate that 3 out of 4 pregnancies at the time of, conception don't quite last to a positive pregnancy test or necessarily a live birth. So we're definitely seeing these trends. There are many reasons as to why, if we look at the exposures that we have today in terms of chemicals alone, and chemicals not just from industry byproduct, although that's a really big factor, and that's present in every aspect almost of life, whether it is that you walk down the road and you're exposed to pollution, or whether you open your tap and you're drinking unfiltered water. Those exposures are definitely happening in a way that we usually don't even notice them anymore. And that's problematic because the body is noticing and it's being kind of translated into the symptoms that we experience, and also into the dysfunction that we now see at higher rates. Like, as I was giving the example of sperm and sperm parameters and sperm count drastically declining. All of these pieces kind of like, they play a role together in the pictures that we're seeing in terms of fertility.
Yeah, that was a very comprehensive answer. I really appreciate how you highlighted the societal part of things, and yeah, considering that most people are living in two income homes, and the woman wants to be professional and successful and has less time or less financial resources for that. I think it's fascinating, and like I said, it was a great answer. And I wanted again kind of deep dive into your history, how you got into this, and especially I take it there's a bit of like I don't know. I don't want to put words in your mouth, but disillusionment with how the system kind of teaches people like you how to deal with infertility, and what things you maybe were not as satisfied with that made you try to approach things in a different way.
Yeah, it's interesting that you phrase it that way. I would say that what keeps me going in this field is a great disillusionment of how things are. What got me into it was complete naivety, and I think that it was this desire of thinking, and perhaps in a very delusional moment, that I could make a difference, to how things are in life and in the world. And by that, what I mean is, my idea when I first started was that I really loved the idea of healthy and happy families, and maybe a product of being young and naive. But I also liked the idea that I could be contributing in that way. So my whole thought from the very beginning was, okay, well, how can I contribute in a way that's going to have a sustaining effect, a legacy of sort, and so babies kind of seemed like an obvious path from that perspective. And I had a really wonderful mentor who was an obstetrician gynecologist at the time, who literally said to me when I said that I wanted to do something related to pediatrics, that was the worst idea I ever had. And in that moment I was like, he was
Wow.
such a loving guy. Like, he was such a beautiful person. Well, he is still. He's very much alive, thank God. But he is a wonderful person. And what was funny is that he was always so encouraging. And then this one day when I said to him that I wanted to focus on pediatrics, he's like, "That is the worst idea you've ever had." And I'm like, "Tell me what you really think, Jim." And he basically was like, "Well, yeah, because, if you think about it, your patients know your patient is a parent of your patient, and your patient can't speak." I was like, noted. Like, in this moment, I've changed my mind. So these are the great conversations that, when they don't go to plan, kind of change the trajectory of one's life. And so this was one of those, because I was like, yeah, this is a really good point this man is making. And I don't love babies that much that I would want to go through that much kind of, detective work to try and figure out what's going on from that perspective. And so, although, oh my God, complete tangent. I went to puppy yoga this weekend, and it
Oh,
reminds me why I love babies. Puppies and babies, they just have this attraction piece, they're so cute and so sweet. But that's essentially what kind of got me really involved, was to figure out, okay, well, how can I make a contribution to families in this area? And so that went well for about 10 years. And then, of course, things happen, and you learn more and you understand more and you see that there are different avenues. And when I had a couple of patients that came into my office that were in very different situations to the patients that I used to see, which were like, maybe 1 or 2 years of infertility, preparing for IVF, preparing for improving their health so that they could, be as fertile as possible. And then I ended up with like two cases back to back, one 10 years of infertility, one 19 years of infertility, both of which I
wow.
was like feeling very ill equipped to handle, and very honest about it to the couples. I said, look, this is not the usual thing that I treat. And so, and the first woman, who was the 10 years of infertility, said to me, look, if you don't treat me and help me prepare for my next IVF cycle, I'm probably just going to give up anyway. So you might as well help me. And I'm like, if you put it that way, like, okay. So we did. And she ended up, like 3 or 4 months later, she was pregnant naturally with her own
Wow.
eggs for the first time in 10 years after multiple failed IVF cycles. So that kind of got me thinking, this is interesting. Maybe there is something to this, but was it really what we did, or was there some other coincidence, that fell into this kind of wonderful composition of events that created this outcome? And so I didn't know, and I wasn't really, ready to kind of really think that this was why, that what we had done was what actually created that result. When the second couple came to me, and that was a 19-year history of infertility, I kind of thought, maybe there is more than just a fluke to what's going on here. And at that point, I decided that I was going to actually transition from helping anybody who was having difficulty conceiving to only helping couples that had more than 2 years of difficulty conceiving and who had a complex history. So they had already tried IVF and it didn't work, or they had some other issue that was, a clear factor that was preventing them from actually having a healthy baby, a clear diagnosis of sort of any kind. And so that's when, even though I still was kind of not really sure whether this kind of system, this framework, this method that I developed was the thing that was really making the difference, I thought, what better way to test it than applying it to this kind of very significantly challenged situation and waiting some years and seeing the results. And so at the time, I didn't really think about it exactly in those terms, but looking back now, I can see that, it was actually, it was perfect the way that it turned out, because 10 years after that, I had enough data that we could actually do a proper study to figure out what are the types of couples that we can help, what are the types of benefits that we actually produce. And that's when I went to do my master's in public health at Harvard. And I basically then ended up studying our program and seeing what was actually, happening there. What were the types of couples? And we noted that, the average number of years of infertility of the couples that I was treating was about 4 years, plus or minus 2.5. We noted that almost 50% of the couples who came to us had experienced previously failed IVF cycles. 51.5% had experienced previous miscarriages, and that rate dropped to 13.5% after treatment. And the majority of the patients out of the whole cohort was 544 patients, 78.8% live birth rate in that cohort.
Wow.
And the majority of those patients, 47.7%, conceived naturally, even some with, previously failed IVF cycles. So then at that point, I was like, okay, this is not some fluke. This definitely, there is a reproducible process here that's actually creating the results that we're seeing. And so I went and started to dig even deeper into it to try and figure out and disentangle, okay, what's actually producing the results. And we obviously know a whole lot more now as a result of having that foundation to spring upon, and that's how it began, and that's kind of how it's going.
Wow, that's incredible. Those numbers are astounding. I think it speaks volumes to you and your work that you chose deliberately to work with the couples that have had the most challenges, and you're kind of the last person that some of these people are seeking out as a kind of a last ditch. I think that speaks volumes to your kind of work. And I'm curious to know, like, what was the difference between what you were seeing, what you were noticing, kind of your methods versus what you were trained in? Did the two kind of match up, or were they not quite exactly the same?
You know, uh, there, I think that there is so much between how I was trained and how standard therapy, i.e., medical, kind of reproductive medicine works, that is not at all the same to what it is that we do. And the reason is that we integrate and we blend the best of both worlds. So, from a naturopathic perspective, we're looking at whole systems in a very holistic way. We're looking at integrating function, not just looking at the egg and sperm. But also from a standard therapy medicine perspective, we're not just looking at ranges and numbers on a spreadsheet, and looking at it and going, oh, yes, that's normal. It's like, well, actually, optimal function is different to like reference ranges of a blood test. And so we need to, that kind of meeting of worlds is essentially what it is that we do, and that we do very differently, and have become very proficient at doing. We don't treat couples in our clinic who have like literally only just started trying to get pregnant, unfortunately, for two reasons. One is that the way the kind we have limited resources, right, in the ability to be able to provide treatment. So we really do focus and specialize on those couples who have some prior issue that we know they're going to struggle conceiving because of some specific reason, or because of history demonstrates that they've had long-standing infertility, or many recurrent miscarriages, or many failed IVF treatments, or a combination of all of those things, or they already know that they're going to struggle because of a prior diagnosis. Right. So those are the kinds of patients that we typically treat. And the reason for that was very deliberate at the time, because we had limited resources. So we had to pick and focus, as opposed to making this as something that was available to every single person trying to get pregnant who may or may not see the value of investing in expertise. And this is the other problem too. Part of the reason as to why what we do is so specialized is because we are outside of standard therapy and the standard medical healthcare system. Because patients have to come to us, they have to actually pay out of pocket, right? And most healthcare systems around the world don't actually cater for that subset of fertility patients who struggle beyond the one or two IVF cycles that don't work. Right. And so, unfortunately, for many of those patients, they will go, and this is because we treat patients in every continent other than Antarctica. So we see every healthcare system around the world, from Australia to Canada to the US to the UK and everywhere in between. And, in those healthcare systems, there's very specific rules and regulations as to how they operate. And some are universal healthcare systems, like in the US, like in the UK and in Canada. In Australia, it's a mix. In America, it's more privatized. So, in terms of fertility treatment. And so what happens is, what's available for couples around the world, if we kind of go back to the mean, which is kind of like the average of everything, it's subpar at best when it comes to fertility care, right? And so what ends up happening is that when couples really struggle beyond that one or two cycles of IVF, and we know from population data in the US that, in order to have close to an 80% live birth rate through a cumulative rate through IVF cycles, you need on average 8 IVF
Oh,
cycles. Now imagine 8 IVF cycles. Now, in the UK, you're lucky if you get 2. And there's a very stringent criteria as to who can access that or who can't. In Canada, depending on where you are, you might get 1 or 2. In Australia, it's semi-subsidized. In the US, an average typical IVF cycle costs $17,000 out of pocket. And so imagine if you're going through and you're needing more than 1 or 2 or 3 or up to 8 IVF cycles to have a baby. Some people don't have the funds, don't have the ability to pursue treatment at that level. And so there's many different complicated, complex situations that end up happening. And unfortunately, that deeper look into why it's failing, why are things not working, and getting the right answers and the clarity that's required to be able to overcome that challenge is typically failed in every one of these healthcare systems, right?
Wow.
So that's kind of where we step in, is like, we don't just want people, like, in fact, we're completely impartial as to how people get pregnant, like whether they're going to be doing donor egg, donor sperm, whether they're going to be doing IVF, whether they're going to be doing, natural conception, whatever it is. To us, it doesn't matter. What matters is, okay, however it is that that person is going to go about conceiving, do they have the best possible chance of making that work? Because as we know, an IVF cycle, when it's required, it's magnificent and it's miraculous. But the reality is that in 70% of cases, a single cycle fails. So imagine the failure rate of the treatment is way higher than the success rate. And
Interesting.
that gets perpetuated, and this is why some people they just can't afford it. There's no access to treatment. And so then it becomes the situation of, when people are really struggling, what are their options? Sometimes very limited.
Yeah, that's very interesting. You mentioned some of the roadblocks that can lead to or be factors in infertility earlier. Some of those things I would maybe argue are a little bit more on the uncontrollable side of things. There are toxins, there's chronic stress. People are of course, you can do stuff to improve those kinds of things, including puppy yoga, by the way. That sounds amazing. I'm going to look and see if that's available. Maybe I would do that. There's ways you can mitigate stress, but at the same time, there's other things that are going to be outside of your control. What are some of the more controllable things that you notice as far as maybe even like metabolic issues that people are dealing with that are contributing to infertility that can be controlled and addressed if somebody wants to take more action and take a step in that direction?
Yeah, that's a really great question. And here's what I will say about this. There isn't There are things, absolutely, that are more difficult to influence. And there are certain things that you can only influence to a certain level. But you can actually improve pretty much 99% of things in your personal environment. And so the thing about it, and even when you can't necessarily improve certain aspects within your personal environment, sometimes there is the potential and the possibility to improve your own internal environment so that it responds and protects to what's going on in a better way, right? In terms of your cells and function and so on. And so there's always going to be something that can be done. The question isn't so much about whether it's possible. Often the question is, do people really feel like that's what they want to do? And believe it or not, I will still see 2025. We're in 2025. We're not in the 1960s or 50s where people don't know that smoking is going to be detrimental to their health. But in 2025, I still see people who have had 3 miscarriages, who are quote unquote desperate to have a baby and will choose not to quit smoking.
Wow, really?
Yeah, I know. And I'm not being judgmental here. I'm just looking at, what do you want more? Do you want
Yeah.
to smoke or do you want a baby? Like, it really is, like, it's a practical decision, right? And yes, I get it. It's hard, and there's, addiction, and there's all of these things. But then you really have to question, what do you want more? Because it's not for every single person. Like, we've all heard of people, right? So epigenetics comes into play in a big way here. We've all heard people who have never smoked a day in their life and die of lung cancer. And then we've heard of people who are chain smokers, like my uncle uncle who basically has been smoking for 50 years, like one cigarette after the other, and has never developed lung cancer. Now, mind you, he has many other health conditions that are associated with smoking, especially cardiovascular disease. But the reality is that that impact of that exposure is differential, and one person will respond to it in a different way to another. Now, here's the thing that happens. For some people who smoke, they might develop lung cancer. For another person, it might be infertility. Now, we know that there is no neutral effect in that kind of situation. Like, it's only going to be the positive effect of quitting or the negative effect of not quitting. And in what organ and system it's going to affect, we don't necessarily know offhand. But here's the quick takeaway. If you are trying to get pregnant, you're not succeeding, and you are smoking, or you're drinking, or you're doing drugs, or you're doing whatever, well, then you need to question, what do I want more? Do I want to continue the behaviors that I have? Or do I want to change for the potential of creating a new future? So I think that that's something that's important to touch on, and certainly important to kind of like bring it to people's awareness, because sometimes we can't see what we're doing in our day to day. Like some people, they literally are the type of people who will come home and to relax, they're going to have 4 drinks 5 times a week, and then on the weekend, they will probably have another 10 each day. So, again, you've got to then question, how is this supporting the outcome that I want to create? And it is getting me closer to what it is that I want, or is it getting me further away? Now, there's also those people who are health freaks, like that I would be put to shame. And I am like up there in a higher echelon of taking care of my health, right? And so what happens is that there are some people who, again, even though they might be doing all of the possible things that they can do, biochemically, there is still some misfiring, miscommunication, kind of differential way in which their body is responding. And that is something that we need to find, because whether it's genetic or because of a SNP or because of some other thing, unless we can actually pinpoint and identify what's happening, right, irrespective of exposures, then there is very little leeway for change or improvement.
Mm.
But there is usually a place where there can be improvement if we understand what the issue is, right? So, and that will be for 99% of cases, right? There's only very few, like literally, it's that 1 to 2% where, okay, here is a line and we can't cross that line, no uterus, no sperm, like different situation, right? So then obviously those lines are very hard lines, and we then have to make other decisions around how else do we optimize those chances and what else is possible. And luckily in 2025, we have lots of different avenues of creating possibility in those types of situations as well. But if we don't know that they're there, well, then we are stuck, for the most part.
Yeah, I can definitely say with my wife and I's journey into fertility, more information was so much more helpful than less information. We identified an issue, without getting too personal, that was completely off of our radar, that forced
Yeah,
different decisions and allowed us to open up other options. And so I'm so grateful for
absolutely.
all the different options. I know you're such an advocate of getting tons of information, blood work, possibly genetic tests, like really trying to find the root cause of what's going on, so you can make much
Yeah,
more informed decisions. Because this stuff, like you said, it's not that cheap to go through. And if you are going through these expensive fertility, treatments, chasing your tail and not getting anywhere when you never were going to get anywhere, that would be
exactly.
heartbreaking, bank
Exactly.
breaking.
And exactly. And when you could actually have known that way in advance, right? And so, and I unfortunately, really sadly, see a lot of these patients. I see the patients who have already spent $250,000 on fertility treatment that's failed. So like it is not for the faint of heart. And the thing about those types of cases is that in every single situation, they say to me, "I wish I'd found you sooner. I wish I'd found you sooner." And I have, the patients who find me sooner and who basically kind of think, "Oh, I've only been trying for 9 months, but it hasn't happened and I'm not getting younger and I just want to kind of see if everything is kind of the way that it needs to be. And then we go in, we find something pretty big that if we hadn't known, if we hadn't found that, we would have been the infertile couple for 10 years, down the track, having spent thousands of dollars on failed treatments. So, there's both of those types of situations where sometimes in the average population, so in general, it takes 3 conception attempts to take home a baby. So literally, for the majority of patients, it's have sex, get pregnant, have a baby, done. We're no longer having this conversation. If we're still having this conversation after 3 conception attempts, we need to dig deeper, because what is going to happen next is that you're going to reach the 12-month mark, after which, you're considered quote unquote infertile. And then you're going to go and see a GP who's going to refer you to an IVF doctor, who's going to literally do some baseline blood tests and say, you start your cycle next month. You go through the process, you inject yourself, you get some eggs if you're lucky. You then go through, you transfer embryos, and you have a negative pregnancy test. That is the experience of most people. Unfortunately, you do get those lucky cases where, and we tend to hear those. We tend to hear that, oh, wow, it wasn't working. I went and did IVF, and the first time we got pregnant, had a baby, it was all beautiful, wonderful. Dig deeper. It's not quite that magical, for the vast majority of patients.
Yeah, and we've covered a lot of the financial costs, but haven't even touched the emotional cost. I mean, the emotional cost of getting your hopes up, doing a treatment, thinking about going through it to do it again, a second, a third, a fourth time, throwing in a miscarriage in there. I think it's way understated how difficult and traumatic a miscarriage would be to have, the hope that this is going to happen and it doesn't. It's got to be heartbreaking. So yeah, it would be so much more helpful financially and emotionally to cut to the chase and get to some of those things. And I know that you are an expert, again, in the kind of metabolic side of things and getting people on different diets. You mentioned the example of smoking. Perfect example of something that this is a behavior that you don't necessarily need to replace with something different. To quit smoking, you've stopped putting cigarettes in your mouth and you've quit smoking. If you can do that, however you do it, you've quit smoking. With nutrition, it's a little bit different because it's not like you can stop eating. You have to continue eating something. So I'm curious how you make your recommendations as far as nutrition goes. Is there a direction you want to see people go in? Is there a particular diet that you favor? What things do you generally want to see out of somebody's diet? And what are the most nutrient dense things that you want to see in people's diets?
Yeah, that's a great question. I have a very simple philosophy on this. Avoid barcodes and make sure that your food resembles what it looks like on the field as much as possible on your plate. So literally, it's that simple. I think that nutrition can be and I have a nutritional epidemiology concentration from Harvard. So I can say that there is so much confusion in terms of nutrition. And some of it is actually on purpose because big food is big food,
Yeah.
and like big pharma, like big tobacco, big food, right? And so there is definitely industry play at in the context of this conversation. And it becomes one of those really difficult things when people are so confused, they just kind of will opt for convenience. And the problem is also that the food environment is dictated by these big industries. I mean, if you think about it, like, and without naming names, let's just say that there is a company that will dictate for populations across the world what will be put in front of them or what will not be put in front of them, simply because of what they actually hold, from water to snacks to everything in between, to supermarkets to everything in between. So then what happens is, I mean, if all you have to do, like if you just go anywhere, if you go to Mexico, in every corner you have an OXXO supermarket, right? Food environment, and what is in those places? Like it's a 7-Eleven type convenience store, right? So what's in those places? Like soda, but sweet beverages and packaged products, snacks, and all manner of unhealthy foods. Now, and of course, they unfortunately tend to be much cheaper than the supermarket bill when you're looking at vegetables, fruits, meat, of all different kinds, protein, all of that. So There's a lot that's manufactured in terms of what we have access to, and there's a lot of convenience inbuilt into this education of the masses, right? And so if we take all of that away, what are we left with? We're left with nutritious traditional diets. And if we were to actually focus on that, what does that mean? Well, vegetables and protein, is essentially what ideally humans should be consuming to be the healthiest version of themselves. So I like to basically guide my patients as, the field to plate methodology that I teach them, which is essentially one step from field to plate. If you look at a cob of corn, right, you can see that thing on your plate, you can literally immediately recognize it on the field. Like, there is no confusion as to what that is. The second that you cut those kernels, that's two steps from field to plate, right? You can still recognize the corn kernels on your plate, but you can see that it's processed. The second you take those kernels and you make, I don't know, creamed corn, right? That's a third processing step. But from there, by the time you make, some other preparation that is like polenta or tortillas or, God forbid, corn snacks, right? That's like a million steps from field to plate. Like, you could not recognize that thing if it hit you on the head. So the reality of it is that the further you get along that food chain from recognizable to unrecognizable, and a conglomerate of nutritional kind of, I can't call it like, it's food ingredients, right? It's substances, it's chemicals. Like, if you look at a packet of chips that claims to be made out of corn, if you actually go and look at the label, the majority of what is on that label are irrecognizable names, right? So the second that you're seeing that, you know that you are far off track when it comes to health and fertility. So the more that a food needs to be cosmetically enhanced or marketed for its nutritional prowess, you know that there's something here that's not quite right. Right.
Got
And
it.
so basically, that's where I'm focusing with my patients. I'm focusing on that 1 to 3 steps from field to plate. You can recognize your food on your plate. You put in your protein. I am a big advocate of making sure that people have enough protein. If they're not macro tracking, which I do encourage, but if they're not doing it, palm of hand, the size and the thickness of palm of your hand of good quality protein at every meal. And that is not processed meats. Okay, so like, processed meats are toxic. In fact, they are linked to all sorts of manners of diseases, from cardiovascular disease to colon cancer to infertility, you name it. So I highly recommend people steer clear of deli meats, sandwich meats, all of those kind of very highly processed, sliced, whatever it is that they're called, meats. They're not really. They're typically a whole bunch of ingredients kind of put together with binders. So, you know, like your chicken breast, your steak, your like good quality eggs, your good quality protein as much as possible. And I think that if you're doing that, oh my God, you are so on the right track, when it
I love
comes
that.
to removing the obstacles to optimum health from that conversation. You're reducing the amount of chemicals that you're exposed to. Because if you think about it, food is actually the biggest environmental exposure that people are exposed to every single day of their lives, multiple times a day. So whether it's going to actually enhance health or decrease it is very much dependent on the ingredients that we are consuming. So
Wow.
that's really where I would say, I don't have a particular diet that I recommend. It's common sense.
Yeah, I love that. That's a wonderful answer, and I'm totally on board with that. It's partially the reason why I think Brazil has the best food recommendations of any other country. It's like 10 steps, and some of the steps are like that. It's just like, eat unprocessed food, eat with your family is one of the guidelines.
Yeah.
Like, that's
Mm,
awesome stuff. I love those recommendations.
yeah.
And the large contingent of our listeners have had to take that diet and take extra steps, and go even more strict into ketogenic diets or carnivore diets, where for whatever reason that was the diet that helped cure something severe. Maybe it dropped their anxiety out. Maybe they reversed their bipolar. Not many people are willing to do strict ketogenic or carnivore diets unless there's something really drastic that they're healing with. And so this is a very honest question. I don't know how you're going to answer. As far as you're concerned on the fertility side, people that do either strict ketogenic or carnivore type diets, are they sacrificing something on the fertility side by being uber strict? Again,
Yeah.
it's
So
there's compromises, right? It's
yeah,
tough.
yeah. So here's the thing. I think that, when it comes to fertility and the fertility diet, what's going to be important is a high nutrient density, across that nutrition. Now, the reason that I don't recommend a strict ketogenic or carnivore diet for fertility specifically, and it's not to say that I'm actually recommending high carb. In fact, I would say that my recommendation for carbs is about 100 to 150 grams per day, which puts it into the low carb
I
type,
define that
you
as
know,
low carb.
recommendation.
Yeah.
Now, here's the thing. Obviously, ketogenic is about the 40, 50 grams. And so that's very, very low carb. But when it comes to fertility, most people that experience fertility difficulties have some kind of metabolic impact, right, in the mix. And so that 150 grams of carbs per day is actually a sweet spot where they're probably metabolizing that carbohydrate in a better way. And that's going to be coming mostly from their vegetables, and I recommend no more than 2 pieces of fruit a day in general. Okay, so that's like a medium-sized apple, no more than 2 pieces. Because what happens is for fertility, especially for women, especially if they have irregular cycles, and for men, if they have, some kind of, sperm problem that is not genetically focused, and they also can do with improving their metabolic health, which majority of patients who struggle with fertility difficulties have some impact or implication from a metabolic perspective. So then that's where we're really looking at it and going, okay, how can we maximize, how can we optimize what's going on here by utilizing the exposures that we know we're going to have? Because as you said, we have to eat, but that we're having it in a way, or that we're doing it in a way that's going to be most balanced for reproductive function. So that's kind of where I would be focused. And it would be and especially for, whether it is PCOS, polycystic ovarian syndrome, which a lot of women, 15% of the population of women of the reproductive age struggle with PCOS or polycystic ovarian syndrome. So those are the types of places where that kind of much lower carbohydrate intake will be beneficial. But it's not to say that you should be avoiding all carbs, or that you should be going completely keto or completely carnivore, because then you actually end up missing out on some of these important nutrients that for fertility are going to be very key, right? So that's where, and also there is a component of increased inflammation with a high carnivore diet for the purposes of fertility. So, there are some trade-offs that we need to kind of make when we're talking about reproduction specifically.
Yeah, that is a wonderful answer. I totally appreciate that. Thank you for explaining that. And I want to just mention two things that seem to just get overpassed, and you mentioned it, and one of them overlooked. Excuse me, and one of them is like, this isn't just a female problem. This is a two-person thing that involves men. So if there's men out there listening and thinking that this doesn't apply to you, metabolic health applies to you just as much as it does to the mother. And again, I don't think enough people talk about what about the life of the child that you're bringing into this world. If somebody is already, very insulin resistant, and you're having a child that thinks it's coming into a world already insulin resistant, that child's life is going to be vastly different than a healthy baby.
Yeah, 100%. And I think you touched that very nicely. I often say fertility is a team sport. The reality is that 50% of the reason as to why miscarriages occur is to do with sperm health or lack thereof. And so, sometimes we think that it's just like, societally, we're kind of almost raised to believe that fertility is a woman's issue because the woman gets pregnant and carries the baby. But in order to affect the pregnancy, we need healthy sperm. And so, 50% of that happening is going to be obviously the male factor. And then on top of that, we also have that situation where we're wanting to carry a pregnancy to term, but in carrying a pregnancy to term, we have a greater outcome at the end of that, which is to have a healthy baby. And so, what you've described and that epigenetic impact, which is the way in which the environment impacts the genes to create the results, whether it's health or lack thereof, for that child in the future, is actually going to be dictated way before a pregnancy is even in place. You see, by 8 weeks gestation, a baby already has all its little organs, all its little fingerprints. Literally, that embryo is set for the rest of its life in terms of its predispositions and what else is going to happen. It's going to develop further from that 8 weeks on. And of course, the genes that will be switched on and off based on environment and the environmental kind of interplay between mother and child and what happens in that woman's kind of life, an external environment and so on, is also going to be having an impact, in imprinting of genes. But really, when we're looking at the kind of environment that we are bringing children into the world, yes, it's a more obesogenic environment. Yes, it's an unhealthier environment than it was 100 years ago in many ways. Sure, we have less chance and risk of infections, and most people used to die from infections, whereas now most people are dying of, no non-communicable diseases, and so which diabetes, cardiovascular disease, you name it, all of which are actually having its kind of inception in the imprinting of the egg and sperm prior to conception even occurs. We also understand now that fertility is intergenerational, meaning that you being, the embryo in your mother's womb, right? You were already in your mother's womb when your mother was being gestated by her mother. And so, it's wild. Like, so imagine this, your grandmother already had you in her womb when she was gestating your mother.
Wow, that's
Because women are born with all
fantastic.
the eggs. Yeah, we're born with all the eggs we'll ever have. So whatever exposures your grandmother had, your mother had, you had. And so,
Wow.
it's like that. And so that essentially means that there's a whole immense interplay that if we're looking at fertility as only a today issue, we're actually leaving a lot of effect on the table.
Yeah, wow. That's such a beautiful thought. I'd never really considered that. And yeah, the way you're explaining it, it's so obvious, the epigenetic side of things and how genes are expressed. Yet what is the population largely told? That obesity in particular is genetic, and we're debating, what age we can start giving kids GLP-1 drugs, and what age we can start, doing gastrointestinal surgeries and all kinds of stuff at younger and younger ages. And you're right, you stack those generations on top of each other, and now you're seeing child onset diabetes. You're seeing kids with fatty liver disease, all these metabolic things manifesting at such a young age because of all the generational changes that we made. And yet, again, the public is told that this is a genetic thing. It's
Yeah.
bananas out there.
Yeah, it is. It's unfortunately, and look, there's a lot of competing interests. I think that that's one of the biggest challenges. And sometimes as well, there is another factor to this, which is, what's easy and convenient. Because for the most part, people will still choose what's easiest and convenient and most convenient over what actually gives the best result, right, in the long term. So unfortunately, there is a bit of human nature, there's a bit of like just laziness, there's a bit of like, environment, there's a bit of all of these factors present in a situation. And sometimes I think that the people who are most highly motivated to change are typically the people who have the most agency. And agency is something that is taught. And I just don't think we're actually we're being taught many things, and I think these new generations are being taught many things about, life, that it will be interesting to see where we land in about 50 years from now. But let's just say that, a huge part of whether somebody will even look for help in a different way or think outside the box is essentially dictated by how they're taught. So I think that the first step is really understanding that, okay, there is an opportunity for taking charge, there is an opportunity for agency. And even now, most couples in a standard route experiencing infertility are just told, no, there's nothing you can do. Just, you need to go down the IVF path. It takes somebody with like a questioning mind to go, surely there has to be more that can be done here to actually choose to look for a different path. It's actually surprisingly and shockingly, if you like, the people who actually end up listening to a podcast like this is a tiny, tiny, tiny percentage of the population, because people already think that they know everything there is to know about,
Mm,
how to overcome infertility by what they hear in the news. And it's like, well, are you sure about that? you know?
yeah.
So
Yeah.
there's a lot to that as well.
Well, I really appreciate that. And that's a perfect segue to talk about how you are helping people with some of these issues. You've got so many different resources out there. Some are more kind of advanced and people need to pay for them. Others you offer for free. So can you tell us all the different ways that you're helping people today with some of this stuff?
Yeah, sure. So the book that you mentioned in the beginning, Overcoming Infertility, I mean, A Fertility Breakthrough is the title, Overcoming Infertility and Recurrent Miscarriage When Other Treatments Have Failed. That is available free on Spotify and YouTube. So that's a great place for people to start to understand more, to learn. There's lots of great information in that book that, and of course it's available on Amazon and every other bookseller. There is also a program that I run and have run for, I don't know, since 2011 now, called the Fertility Challenge. It's a free program. It runs over 30 days. It's my team and I who literally run it live. So you have the opportunity to ask questions. It's completely free. And, you come in and you learn. And if it feels like you want to take a next step from there into paid treatment, then there's some other avenues around that. But I feel like, the Fertility Challenge has been one of those kind of cornerstones of public health education for us, really. That's kind of what led me to wanting to study public health at Harvard, and to wanting to kind of bring this to more people. And we have been really successful in doing that, in 111 countries, many, many people around the world. And it's something that I'm very passionate about, because I really believe that in order for people to know that they can change, they need to learn that they can, and they need to learn how. And so what this does is it enables that level of agency. It enables that level of understanding that, okay, maybe there are lots of things out there that I cannot influence and that I cannot change, but there are so many that I can. So let me figure out which ones they are and what I can do about it with my partner, and improve the chances of taking home a healthy baby. And I know, because I've been running this for such a long time, we get babies from the Fertility Challenge, which is our food program, all the time. So people go through it, they learn, they implement, then, they go from having difficulty conceiving to having a beautiful baby. And it's so frequent that I get messages, on Instagram and Facebook, and people telling me, Gabrielle, I just wanted to let you know I did your program and I got pregnant, I had a baby. Thank you so much. And we've never met. So, and look, it does help that I have been doing this since 2001. So it's been a very long time in the trenches and in the field. I've got babies who have graduated from university and have gone into the
Uh,
army, and who,
uh,
are kind of like changing lives themselves now, which is kind of like, I look back and I go, gosh, like, has it really been that long? When my first baby graduated from university, and the mother sends me a message and says, just letting you know, so and so graduated from university. I'm like, okay,
uh.
hold that clock, hold that clock. It's all going a little bit too fast, but it's amazing. It's pretty incredible.
Wow. Well, you mentioned passion, and your passion just pours out of you. I've thoroughly enjoyed this conversation. I think it's a great way to end the conversation. Before I grab my Brazilian jersey and go cry in a ball in the closet over the 2014 loss to Germany,
Yes,
that's still
yes,
very, very acutely
very
painful.
sore.
Exactly. Before I go do that, where can people go to find you and connect with you and your work?
They can go to fertilitybreakthrough.com, which is my website, or they can Google my name, Gabriela Rosa, Gabriela Rosa, Gabriela with one L, and fertilitybreakthrough.com.
Excellent. We will link to that in the show notes. I hope this is not our last conversation. I hope our paths cross once again. And, this is just a flyby of everything that you do today, but I think it's a really empowering and wonderful message that you share, that there is hope. There is always something that you can do. And yeah, like I said, you're so passionate about it. I've absolutely loved this conversation. So thank you very much, Gabriela, for all of your hard work. And thank you for taking time to be on our show today. We really appreciate you.
Thank you. Thank you. It's been such a wonderful pleasure. Thank you so much.
So much fun. It was such an honor to host you. And this has been another episode of Boundless Body Radio.